I'm Dr. Frida, and today we're going to discuss the painful truth about kidney stone symptoms. Now, kidney stones are nobody's friend. They are exceedingly painful, and they're actually quite common. Kidney stones, if left undiagnosed and untreated, can actually lead to some major complications like overwhelming infection or septic shock. Kidney stones can also lead to kidney failure. Yeah, they're a problem. The tricky thing about kidney stone symptoms is that they can vary greatly from one person to the next. They can present in all kinds of different ways. So whether it's flank pain or blood in the urine or pain in your testicle, it is important that you are able to recognize kidney stone symptoms. So let's talk about it. Today we're going to discuss the painful truth about kidney stone symptoms. 8 warning signs you should watch out for. Keep watching. I'm Dr. Frida, a board-certified kidney and hypertension specialist, and today we're going to discuss the painful truth about kidney stone symptoms. 8 warning signs you should watch out for. We're going to talk about what a kidney stone or nephrolithiasis is. I'll give a brief overview of how a kidney stone forms. Then I'll discuss why it's so important that you're able to recognize the symptoms of a kidney stone. And lastly, we'll talk about the painful truth about kidney stones. I'll give you 8 warning signs that you should watch out for. So let's get started. So what exactly is a kidney stone? Well, it's exactly what it sounds like. It's a rock inside of your kidneys. The other name is nephrolithiasis. Kidney stones are formed usually when you have a supersaturation of particles. So if you have enough particles or substances floating around in your urine and they stick together and then stick inside of the kidney, well, then they form a small crystal. As other particles and substances flow by in the urine, they stick to that crystal and then you form a kidney stone. Now, there are different types of kidney stones. 80% of them are made of calcium, usually calcium oxalate. You can also have calcium phosphate stones, struvite stones, uric acid stones, cysteine stones. They're different kinds, and they can present with different symptoms, and they can also have many complications. The potential complications are why it is so important that you're able to recognize the symptoms of kidney stones. Complications may include UTIs or urinary tract infections. You can get an overwhelming infection of the kidneys or pyelonephritis. It can also lead to an overwhelming infection of the entire body, leading to septic shock. You can also get a blockage of flow or obstruction that can lead to kidney failure. And so the kidney stones can be a very big and bad deal. So now let's get into the painful truth about kidney stones. I'm going to give you 8 warning signs you should watch out for. Number 1, pain. Pain is the most common symptom of kidney stones. You can get pain in the back, the side, the flank, the groin. The pain due to kidney stones is for a number of reasons. One, it can be due to blockage. If a kidney stone is large enough, it can cause a backup of urine in the kidney, which can lead to a stretching of the kidney, which is painful. Also, you can get a renal colic. And this is a different kind of pain because it comes and goes. It may come and really be strong, like a 10 out of 10, and last for 20 minutes or an hour, and then it may release. And this is what's happening. You have a certain movement in your kidneys and in the ureters, like a peristalsis, and there is a contraction, okay, or like a wave. And when you have a wave that tightens, then it can tighten around that kidney stone and cause a pain. And so that's why people will often describe waves of pain with kidney stones. The pain can be in the back or the flank, especially if the stone is higher up. And if the kidney stone is a little bit lower, then it can radiate. That pain can radiate from the back all the way down to the groin. And if the kidney stone is a little lower, like in the ureter, that tube that is between the kidneys and the bladder, well, you can actually get pain in your testicle. Or if you're a lady, you can get pain in your labia. And labia means lip. This is what happens. Pain is not always just localized in the flank or on the side. That's where it's pretty common, or in the groin. You can also get just a diffuse abdominal pain. You can get pain all over the abdomen with kidney stones. Pain can be treated with analgesics or pain medicines, like Toradol is one that is popular. Make sure that you consult with your physician, or if you have chronic kidney disease, you let the ER doctor know, because you may not be able to take that NSAID, that non-steroidal anti-inflammatory drug, but there are other pain medications that can work. And of course, correcting the underlying problem, getting rid of the kidney stone, is going to be the absolute treatment. 2, painful urination. Now, the pain when trying to urinate when you have a kidney stone can come to the kidney stone moving further down as that urine flows past. And if that kidney stone moves to a spot where it's tight and it starts scraping against the inner portions of your kidney, that can cause a pain. Also, as I mentioned, that wave, that peristalsis, that contraction in the kidneys and the ureters as the stone moves can also cause a pain while urinating. If you get a complication of a urinary tract infection, then of course that can cause dysuria or painful urination as well. 3, a frequent urge to urinate. Now, if you have a kidney stone, again, and it's causing a blockage, then it can give you a sense of fullness in the kidney, or depending on where the stone is located, it can give you a sense of fullness in the ureter or in the bladder. And it can make you feel like you have to urinate. And so you will run to the restroom quite frequently, but you get there and you really can't go. Oftentimes because the stone is blocking the urine. So you may have a fullness, you have the urine that's there that really needs to get out and wants to get out, but you could have a blocking stone. So that can give you the urinary frequency. And again, if you actually do have a urinary tract infection, well, that also can cause the symptom of a frequent urge to urinate. 4, blood in the urine or hematuria. Now, you may or may not have blood in the urine. You can have a gross hematuria, which means it's blood that you can see with the naked eye, or you can have a microscopic hematuria, meaning that you can't see the blood, but when you go to the doctor and they test your urine, they're able to see that red blood cells are there. Hematuria can occur with kidney stones, most definitely, the blood in the urine. There's one study that showed that 10 to 30% of the cases of documented nephrolithiasis or kidney stones did have blood in the urine. There's another study that revealed that 2 out of 3 people with stones down in the ureter had blood in the urine. The tricky thing is that sometimes it depends on the timing, because there has been another study that showed that for patients who presented on day 1 of symptoms, 95% had blood in the urine. But of patients who presented on day 3 or day 4, only 65 to 68% had urine. So it is variable. The blood in the urine is caused by the stones literally scraping and scratching the insides of your kidney. Okay, they're literally scraping and scratching on their way as they move through the kidney, and this can lead to blood in the urine. Now, if you see blood in the urine, you definitely do want to consult with your physician. Now, the way the blood looks in the urine can vary. It can be just a pink tinged urine or orange or just little drops of blood, or you can get outright bright red blood in the urine. You can just be urinating out blood. And in that case, you definitely want to consult with your physician or go to the ER even. And certainly if you have symptoms of lightheadedness, or if you feel like your heart is having palpitations, this could be a sign that you're losing very significant blood. And again, you want to activate the EMS or call 911 if you have that type of situation. Either way, you want to consult with your physician. 5, nausea and vomiting. Now, we know that nausea and vomiting can really be kind of non-specific symptoms, but nausea and vomiting can be your presenting symptom or warning sign of a kidney stone. And it could be for a number of reasons. It could be because the pain is so severe that it's causing you to feel nauseated. It can also be caused if you develop an overwhelming infection because of the kidney stone. If you have sepsis, and this can cause you to be nauseated and to vomit. The treatment will be, again, treating the underlying kidney stone, and certainly you can get antiemetics or anti-nausea medicines, as well as medicines to control the pain and antibiotics if you have an infection. If your nausea and vomiting are so severe that you cannot keep down fluids, you definitely need to go in and see your doctor, because you likely will need IV hydration. Being dehydrated would put you at an even higher risk of the kidney stone. Plus, if you're nauseated and having the vomiting, you're not going to be able to keep down any pain medicines, and it could just be a miserable situation. 6, fever and chills. If you have had this kidney stone and it has caused a blockage or a backup of urine in your kidney, you can certainly get a urinary tract infection. And the urinary tract infection may start off being in the kidney or even in the bladder, but then it can lead to a sepsis or an overwhelming infection that can make you very sick and give you fever and chills. If you have pyelonephritis or an infection in the kidneys, that can cause a fever and chills as well. You definitely want to go in to see your doctor. You need to have your urine tested and you need to have your blood tested for an infection as well. They can treat you depending on what they find with antibiotics, with fluids, with pain management, and with nausea medicine if necessary. 7, cloudy or foul smelling urine. Now, y'all know this is a problem. The urine can be cloudy if you have a kidney stone for a couple of reasons. One, if you're actually passing bits of the kidney stone or if you're passing something like gravel in the urine, the presence of the stones can cause the urine to look cloudy. But if you have a foul smelling urine, then you likely have developed the complication of a urinary tract infection. Again, you definitely want to go in, you want your urine to be tested, the blood to be tested if necessary, and you want to have antibiotics given. 8, difficulty passing urine or just inability for the urine to pass at all. Now, this is a problem. This is an emergency. If you're having difficulty passing your urine, then it likely means that the kidney stone has caused an obstruction, a blockage. And if you have a blockage in your kidneys to the point where you can't pass urine, this can definitely lead to a backup of urine that causes a pressure inside of the kidneys or hydronephrosis, and it can lead to kidney failure, and it can lead to kidney failure very quickly. So if you're not able to pass urine, you likely have obstruction or blockage, and you need to go to the emergency room. They will evaluate you there. They'll do imaging. They'll do all of the things to check you out for kidney stones. Most importantly, they can relieve the obstruction. They can relieve the blockage. It may be as simple as them placing a Foley catheter or a urine catheter to, see if they can bypass where a stone is, or they may need to consult with a urologist who may need to put a scope in you, a cystoscopy, where they actually take a camera and a light and they go and they look and they see, is a stone in the ureter? Is a stone a little bit higher up? Is it a bladder stone? And they're able to retrieve the stone and remove it that way. If that's not enough to remove the stone, there are other procedures like lithotripsy, where the urologist can actually use shock waves to break up the stone. And if it's even more complicated than that, like for example, if you have one of these large struvite stones, the magnesium, ammonium, phosphate stones, they may actually have to do an open procedure. They can often do it laparoscopically, but a urology consult would be in order if you have an obstruction that a Foley catheter can't relieve. It is important to detect kidney stones early to be sure that you try to avoid some of the complications like obstruction, sepsis, kidney failure. Kidney stones in many cases can also be prevented. If you're someone who's already had a kidney stone, then there's a great chance that you will have another kidney stone unless you prevent it. And you can prevent it by drinking a lot of water and by actually having your urine analyzed to find out what substances or particles are causing your kidney stones. The gold standard for diagnosing kidney stones is a CT scan with low radiation and no contrast. Kidney ultrasounds and radiography can be used as well when needed, especially in pregnant ladies. If you found this video to be helpful and informative, please be sure to like it and to share it with the people you care about. I thank you for watching. I appreciate your support, and please do your best to live your healthiest, happiest life.